I would say that every nurse is an innovator because you have to be, right? Like you are at the bedside and something isn't working correctly. What do? You come up with a solution. We don't sit there and wait and say like, oh, I wish this would be better. Or like, oh, no, you like find some tape, you like tape it to the pole to make it work better. So I think in that way, inherently we're innovators. So what that leads to for me is we are also the ones who are seeing those problems as they occur. And so I think that one of the ways that nurses often are using or engaging with scholarship and they don't recognize it is if they see an article that comes out about like some new care practice, or maybe they saw a poster at a conference and they wanted to bring something back. That is scholarship, right? So we have a couple of like major categories that I usually guide nurses into as far as when they want to engage in scholarship. The first is research. The second is evidence-based practice. And then the third is quality improvement or QI. I would say almost all nurses are doing some sort of evidence-based practice. It may be informal, but you are learning best practices from other individuals, from other organizations, and you're applying it to your practice. I also think a lot of us are doing quality improvement, right? We have a system at the unit level that maybe isn't working right. So maybe when we take our patients off unit to go for imaging, there's some sort of a delay. We don't have a smooth process there. So we end up wasting transport time. We end up getting frustrated patients and families, and it just generally isn't a good system. So what do? We take a step back, we look at it, we think about like, okay, well, why is there this delay? What can we change? Maybe it's that we have, instead of the nurse going off the unit to take the patient, we have a transport person come. We look, we see if that improves the process. If not, we go back, we tweak some other things. That's what we call an iterative process. That's quality improvement, right? We're looking at our systems, we're changing something in the system, and then we're looking at the outcome to see if it changes. And then research. I know research is a scary word, right? But what I would say is research is something that as nurses, we would enter in very intentionally. It would be when we see a challenge, maybe we go to PubMed or we see what evidence is out there to address that challenge. Maybe it's something with, we're having high surgical site infection rates and we don't find anything that makes sense for our patient population and our setting. That is when you think, okay, well, if there isn't evidence out there, maybe we need to create that new evidence. And that at its heart is what research is. It's a systematic process to create new evidence.